Hello, my great community. How are you? It's always a pleasure sharing this knowledge that we get every day, from books, from experience, and also from people that we interact with. And just to continue on our family planning, sessions. In my previous video, I talked about Depo-Provera, that is a medroxyprogesterone injection that is usually given every 3 months. And as an extension to that, some other people wanted to know about implants. And I said maybe I'll do a short video also about the implants, because all these things, you have to be given an option to choose which suits your body. So your doctor, your healthcare provider will be giving you options, whether to take barrier methods, whether to do pills, whether to do injection like Depo-Provera, or whether to do IUCD, or finally whether to do implants. So basically, implants are small, very flexible rods that contain hormones and that are inserted under the skin. Usually, the healthcare provider will insert it on your upper arm, on the inner side of the upper arm. And of course, they are used to prevent pregnancy. And they are highly effective, just like we talked about Depo-Provera. Also, these implants are highly effective and also a long-lasting form of contraception. They last between 3 to 5 years, and I will tell you which ones are 3 years and which ones are 5 years. So, like we said, also with Depo and the other family planning methods, maybe others, you will get side effects with these implants also, and those include irregular bleeding, like intermenstrual bleeding, and in rare cases you might also get serious complications like blood clots in your blood vessels, or infections while inserting if the healthcare provider will not use aseptic technique, or will not be will not conform to the guidelines that are there to insert them, then you might get infections. So when you go to types, I told you there are 3 years and 5 years. So when you go to types, we have the single rod. Single rod means just one flexible rod. Etonogestrel implant. So the hormone inside there is etonogestrel. Basically, these implants contain also progestins. They don't have estrogen. So, and the most common type of this etonogestrel is Nexoplanon and Implanon. Implanon is the most commonly used, like where I come from, Kenya. Implanon is the most commonly used, single rod etonogestrel implant. The two rod, we also have the two rod, like you'll be, two rods will be inserted for you under your skin of the upper inner arm, and these include Norplant and Jadel. Okay, so like I said again, the uses primarily we are using them to prevent unintended pregnancies. So this is the most common use, and they are long-acting. So they will offer you a convenient long-term contraceptive solution without really worrying about daily or weekly administration or taking of pills or injections, So if it's 3 years, it will take you 3 years, then you can renew, you can do another one. If it's 5 years, the same. Okay, and again, these implants usually have a beneficial side effect that they are used sometimes to manage heavy menstrual bleeding, what we call menorrhagia, in some individuals. That is, like I said, the common side effects will be there: getting unpredictable bleeding in between periods, spotting in between periods, heavier or lighter bleeding in some people again, or sometimes even complete cessation of periods, where they stop over a period of time when you're using them. The other common side effects, you might experience a headache, acne on your skin, weight changes, and weight changes again due to the progestin in it. The appetite will increase, and then you will, of course, eat more food, and you will gain weight. You might also get breast tenderness, that is, painful breasts, and mood changes, among other side effects. Okay. I also talked about the rare but serious complications like blood clots in your veins and allergic reactions, and also sometimes might be associated with stroke and infection if the healthcare provider that is inserting it doesn't adhere to aseptic technique during insertion. So this is basically it. I don't know whether I have anything else to add, but just effectiveness, I told you again, I'll repeat again, it's highly effective with a very low failure rate when you use it correctly. And reversibility, you can remove any time, and it needs to be removed again by a trained healthcare professional. And fertility typically returns quickly or almost immediately after removal. And this is different from Depo-Provera that we said it might even take 6 to 10 months. So if you want to conceive immediately after removing your implant, you can. So, but again, all these things you need to discuss with your healthcare provider, about the risks and how your body might receive it, and whether you have any other complications like abnormal uterine bleeding before you go into some of these family planning methods. So I've talked about the advantages, I've talked about the side effects, and also this one of the advantages is that it doesn't so much interfere with your libido or sexual spontaneity. And again, it will be hidden. Just like when you take an injection, it's hidden. No one is going to see it. It's not like the barrier methods. It's not like the pills. So it's hidden beneath the skin. And it's also safe for people who are not eligible for estrogen-containing birth control methods. These basically are people with people who are susceptible to, people who are susceptible to some certain cancers, and they are not able to use this. People who are having other conditions that they are not, eligible to use the estrogen-containing contraceptives. And also another advantage is that you can use the implants while you're breastfeeding. This is another very big thing. And like I said, it can reduce your heavy menstrual bleeding, what you call menorrhagia, in some people. And that's basically it. And in comparison with the IUCDs, you can see both of them are long-acting, and the reversibility is almost immediate. So briefly, I will talk about each specific type of implants, subdermal implants. We call them subdermal or subcutaneous. So Norplant is a levonorgestrel, like I said, and it basically comes with a 6 capsule, and each contains some level of levonorgestrel hormone, and it goes for 5 years. So 5 years, after 5 years, you need to change it. The other one is Jadel. Okay, Jadel contains also 2 silastic rods, two rods, flexible rods, and each contains also some, some level of hormone, progestin, levonorgestrel, that is, and also it goes for 5 years, and after 5 years you can change it. And then we have the ones for now 3 years, that is Implanon and Nexplanon, and these contain etonogestrel, like I said, and same amount, almost same amount of etonogestrel, and both of them can go for 3 years. So 5 years we have Norplant and Jadel, and then 6 years we have Implanon and Nexplanon. Or if you want to talk about the hormones, we have levonorgestrel for 5 years and etonogestrel for 3 years. So basically that's it. I think I will be welcoming any questions that you might be having in the comment section. So feel free to ask any question, and I'll be here to answer them. And also feel free, before you engage or before you use some of these family planning methods, feel free to talk to a qualified and a trained healthcare provider so that they can guide you accordingly to avoid complications, especially if you have other ongoing issues with your health. Thank you very much, and please don't forget to subscribe to our channels, and also like our videos and share with your friends so that we can have a wider reach. Thank you, and see you next time, inshallah.